If you've been told you have PCOS, polycystic ovarian syndrome, I've got an important announcement for you. The name of your condition has changed. It's taken decades, and honestly, it's about time. I'm Dr. Lora Shahine, a double board certified OBGYN and reproductive endocrinologist, taking care of patients for almost 20 years, begging for a change in the name of the condition we currently know as PCOS or polycystic ovarian syndrome for years, and it has finally come. Why is this important? Because PCOS is so much more than just an ovarian syndrome, and the new name finally reflects that. I am so excited about this name change. I think it will help decrease time to diagnosis. It'll decrease less confusion. I'm hoping it leads to more research in this. I truly am hopeful for the future for people that have this condition, and I can't wait to tell you all about it. If this is your first time finding this channel, welcome. I am so glad that you're here. Be sure and follow so you get my regular reproductive health information, videos, and education. There are two other ways to learn from me and stay in touch. One is my weekly newsletter. The link is in the description below. And second is my Brave and Curious podcast. This is a podcast you can listen to anywhere you listen to your podcast. You can see the playlist here on my YouTube channel. It's an incredible deep dive, interviews with experts, and I had a lot of content about PCOS that we should now be calling by its new name. But I'm really hopeful that I can teach you, educate you, and I'm just so glad that you're here. So what happened? On May 12th, 2026, the Lancet, an internationally well-recognized medical journal, announced a new name for PCOS. Polycystic ovarian syndrome is now to be referred to as PMOS, polyendocrine metabolic ovarian syndrome. Only one letter has changed in the acronym, but the new name is so much more inclusive. This is no small announcement. This effort, led by Professor Helena Teede at Monash University in Australia, alongside leaders from International Androgen Excess Society, the PCOS Society, multiple international groups and professional organizations and patients all came together to decide this was the right move. More than 14,000 people weighed in with clinical surveys, online surveys. This was not just a snap decision. It was a really big effort. Why does this matter? Because PMOS impacts 1 in 8 women worldwide. That's over 170 million people. And this condition impacts more than ovaries, and it's more than important just in your reproductive years. It can impact metabolism, mental health, weight, skin conditions, cardiovascular risk for diabetes. And yes, of course, it's important for fertility, but again, it's so much more than that. For almost 100 years, we've been calling it something that didn't fit this inclusive condition that we now know so much more about. Today, I'm going to walk you through 6 topics. Topic number 1, how PCOS got its new name. Topic number 2, what this actually means. Like, why does it matter? Topic number 3, how the change actually occurred, like the mechanisms and the actual feat that happened is amazing. Topic number 4, what the new name PMOS actually means. Topic number 5, what happens next. Topic number 6, what gives me hope about the future with this new name. Now stick around to the end where I'll give you 3 top tips for how to talk to your provider about this new name and what this actually can mean for your current and future health. Topic number 1, PCOS, this name, where did it come from? So to understand the name change and what this means, we have to go back to 1935 and 2 surgeons that were doing surgery on women with irregular periods, signs of extra androgen or male hormone excess, and a couple other signs and symptoms were looking at ovaries when they were doing surgery on these women, and they saw that their ovaries looked a little bit different than people without this collection of signs and symptoms. Their ovaries had lots of lumpy, bumpy looking sort of cyst-like structures on the outside. And so these 2 surgeons Dr. Irving Stein and Dr. Michael Leventhal named this condition polycystic ovarian syndrome based on what ovaries look like during surgery. This condition was called Stein-Leventhal condition or syndrome for a number of years. Until finally it was renamed PCOS or polycystic ovarian syndrome based on what these two surgeons saw at surgery. But here's the catch. What they were seeing is not technically cysts. I mean, yes, cysts are fluid-filled structures in the body. They were seeing just a lot of resting follicles that were sitting on the surface of the ovary trying to ovulate and release an egg. And there's research after research that shows that people with PCOS don't technically have a higher risk of pathological cysts or increased risk of ovarian cysts or what we think about as harmful. This name, though, is so confusing. This complex, lifelong hormonal condition really got narrowed down into something that these guys just saw during surgery. But that leads into topic number 2. Why did this cause so much harm? Like, why does this name change matter? Because the name of polycystic ovarian syndrome really laser focuses in on the word cysts, which can sometimes make people really nervous. My patients are so nervous when they hear, oh my gosh, I have multiple cysts in my ovaries. This is something pathological and bad. I've wanted to rename PCOS for years. I wanted to call it polyfollicular ovarian syndrome or polyegg ovarian syndrome and just take the word cyst out of it because, again, we think of cyst as something so negative. And these are just little fluid-filled structures. I talk to my patients like, this is one of the reasons that a lot of people with PCOS have irregular and unpredictable menstrual cycles because they're not ovulating regularly. And then these little follicles just kind of end up on the surface of the ovary, but they're not pathological or abnormal or harmful cysts that we often think of. And so this name, first of all, made people really anxious, made people confused, and then it really didn't focus in on the complex nature and the inclusiveness of the disease itself or the condition itself. This is a polyhormonal or polyendocrine, a metabolic condition that impacts so much of our system, but we laser focused in on it oh, it's just an ovary issue and it's just only important when you're trying to get pregnant and it can impact fertility. This is true, but it's a small piece of the puzzle. And so this name really led to confusion. It led to delay in diagnosis, and it led to doctors and patients kind of forgetting about it after their reproductive years. But we know that PCOS is lifelong and can lead to long-term issues like increased risk of mental health issues like anxiety, depression, increased risk of type 2 diabetes, increased risk of cardiovascular disease. I have an excellent YouTube video here all about lifelong risks of PCOS. And an important message I'm trying to get out there is that PCOS is more than a fertility issue. It's more than an issue that we should only think about in our reproductive years. So watch that video. And this new name, PMOS, really embraces this multi-organ, multifaceted, multi-endocrine condition. And so it's so important. I'm so happy about this name change. Topic number 3, how did this name change actually happen? I have been caring for people for almost 20 years with PCOS. I've been begging for a name change and actually trying to use a different name with my own patients. But I'm just one doctor in Seattle. I can't enact this incredible international name change. So how did it happen? It's really started about 14 years ago with this professor, Helena Teed at Monash University in Australia. She started a consortium, which would eventually be called the Global Name Change Consortium. She worked with other professors and other doctors from multiple different countries to come together to try to make this happen. They brought in 56 leading academic, clinical, and patient organizations to get on board. They surveyed over 14,000 patients and clinicians on their feelings about a name change. And when they did the survey, they found that 86% of surveyed patients and 71% of healthcare professionals supported having a new name to PCOS. Most people who have the condition or who take care of people with the condition realize that the old name was causing harm. So when they realized that the majority of people wanted a new name, then they set to figuring out what that new name would be, and they wanted to adhere to 5 important principles. Number 1, the new name had to be scientifically accurate. Number 2, it had to be clear. Number 3, it had to reduce stigma. Number 4, it had to translate well across cultures and languages. And number 5, it had to be realistic to implement globally. So 14 years, 6 continents, dozens of organizations, thousands of patient voices, and an evidence-based process brought together the new name. That is how you change something this big. Topic number 4, the new name, PMOS. What does it mean? So let's break it down. P, polyendocrine. Poly means multiple, endocrine means hormones. This is a condition that impacts multiple hormones across your body. We're talking androgens, insulin, anti-Müllerian hormone, and the multiple complex interactions between them. M, metabolic. This is huge. This part of the new name really delves into something that clinicians like me have realized for years. This condition is strongly tied to insulin function, metabolic health, cardiovascular risk, and weight regulation. Putting metabolic in this new name really signals to patients, researchers, people who fund research that metabolism is a huge part of this condition. This is not just a reproductive issue. This is something that is lifelong and impacts overall health and well-being. O is for ovarian, so it's staying true to the point that the ovary is really important in this. And I think keeping this in the name also makes it easier to change. So it's easy to go from an acronym that is PCOS to PMOS. And then S, the last one, is syndrome. Syndrome means it's multiple clinical signs and symptoms that come together to give a diagnosis of a condition. Now, the diagnostic criteria is essentially staying the same. You have to have 2 out of 3 conditions or signs or symptoms. Number 1, irregular and unpredictable menstrual cycles due to irregular and unpredictable ovulation. Number 2, signs of elevated androgens. Androgens are male hormones, so this can be labs that show high levels of androgens, or clinically, you can have high levels of androgens showing up in acne, excessive hair growth, especially centrally, or hair loss, especially in a male pattern, like on the top of your head or kind of at the forehead, sort of male pattern baldness. And finally, the third is high follicles that are kind of up for grabs, either a high antral follicle count on an ultrasound, seeing lots and lots of follicles on those ovaries, or you can do a blood test called AMH, or anti-Müllerian hormone. And if that is above average for your age, that can be another clue. So the name shift is important. You don't even necessarily need to see ovaries on ultrasound to still get the clinical diagnosis. And it opens the door for treatments to evolve, noting that this is multiple endocrine or hormones involved, noting that the metabolism piece is important. It allows us to focus on different treatments and different research in order to truly help anyone with this condition. So topic number 5, what's next? Well, this takes time. Change takes time. I bet a lot of providers, for people with women sitting in their office with PCOS, are not even going to be aware of this change yet. And so there's a 3-year grace period worldwide where people can still use the terms PCOS and PMOS interchangeably. Insurance and billing takes time to get new language, updated. Of course, clinical research is going to need to have some time to kind of use both terms interchangeably. So there's a 3-year grace period where you could say PCOS or PMOS. So a few important things to realize in this transition period. Just because the name has changed, that doesn't mean that your diagnosis has changed. Your diagnosis is still valid. Nothing has to change in your medical records going backwards. Your treatment plan doesn't change overnight. Your medications, your strategies, your doctors can still stay the same. You really don't need to do anything administrative or take action right now. It's all about awareness and the future of this condition and sort of help that people might have. If you're new to this and you recently are being evaluated or kind of getting this diagnosis, you might see the term PMOS in your medical records instead of PCOS. Topic number 6, why I am so excited about this and why I'm hopeful about this name change for the future. I want to be honest with you about something. As a reproductive endocrinologist and someone who's helped women with endocrine issues, fertility for almost 2 decades, I have sat across from women that are so tired of feeling dismissed, confused about their diagnosis, really locking into the ovarian piece of this and not understanding that being diagnosed with PCOS in their reproductive years is a huge window into their current health if they happen to be in midlife or later, or their future health. I think this name change is going to dramatically allow more education about this topic and this condition. When I see this happening, I get emotional because I think it's going to make providers and patients pay more attention to this overall impact of this condition. I think it's hopeful, and I'm hoping people will get diagnosed sooner. I hope people will get more education about this, the insulin impact of this condition, the overall wellness, the mental health aspects, the skin changes that can happen with this, the future risk of diabetes and cardiovascular disease. I am truly hopeful that the name change will lead to more education and better and well living for people in the future once they know they have this disease. Another aspect, I truly hope this sparks more interest, more funding of research, and a more collaborative approach to this condition in medicine. For so long, and what I was taught in medical school and a lot of my training at UCSF and Stanford even later, PCOS was really kind of in my wheelhouse as a reproductive endocrinologist. It was, focused on ovaries, focused on people who are trying to get pregnant and fertility treatment. And, we are the experts in it, truly. But we only usually follow people for a very short time in their overall life. And I do try to educate my patients as soon as we get a diagnosis. I'm like, hey, this is not something that we're just going to focus on as I'm trying to help you have a baby. This is something you got to think about and tell all of your doctors in the future that you have this. But I know, and this is human nature, people can forget about it pretty easily. They know that they need to focus on it, then they get pregnant, they have the baby, and then they're postpartum, and there's just so much going on in life. But I am hoping with this name change that internists, family medicine providers, all these other aspects of medicine will kind of come together, like the regular endocrinologists that really focus on diabetes. And they do sometimes get patients with PCOS. I hope that they can see this overall connection that people in my field have seen for years. That is why I am hopeful. I'm hopeful that people get diagnosed faster. They learn more about the overall pieces of this condition, that funding increases and more research happens, and that honestly, people live healthier lives. Words and language shape medical care, and so better naming, more accurate words in the diagnosis, I hope leads to better medical care. Now let's recap. Big announcement in Lancet Medical Journal, May 2026. PCOS, polycystic ovarian syndrome, has a new name, PMOS, that is more inclusive about the multiple endocrines and hormones that are involved, the metabolic piece, which is important, and ovary is still in the name, but we took out that scary word cyst because it didn't ever make sense. This was an incredible feat of international medical societies, patients, healthcare providers, academics coming together to make this big decision. And I am hopeful for the future for better understanding of this condition and more research and funding to help people live healthier lives. I'm glad you stuck around to the end of this video because I want to share some really important points to talk to your doctor about this condition, because there's a real chance that your doctor might not actually know about this update yet. So here are 3 questions to ask your doctor. Question number 1, beyond my condition and just reproductive care, what should we be monitoring and thinking about my overall health and wellness with this PMOS condition? Question number 2, my understanding is that PMOS is a condition that's affecting multiple hormones and has a real metabolic piece to it. With that information, should we be targeting insulin resistance and looking at other metabolic issues for my overall health and sort of the big picture? And question number 3, I know that this is an ongoing, update, and over the next 3 years, we're probably going to learn a lot more. But what can I think about over the next 3 years as far as bringing symptoms to you, tests that we could do to kind of look at my metabolic health, and updates along the way? Let's really partner in this. And so be patient with your doctor if they are an empathetic, compassionate provider and they're listening to you. If they haven't heard about this, it just really does take time to get the message out there. So you might be the first person telling them about this, but I want it to be a hopeful conversation and allow them a little bit of time to kind of see how they can piece together the best care plan for you. And guess what? If they are not interested, if they dismiss this update from you, this is probably not the right provider for you if you really have this diagnosis, and it's okay to get a second opinion. I hope this video was helpful for you. I hope you learned a lot. Like this video if you learned something. Share this video with your friend or loved one with PCOS, now PMOS, because this impacts them. Be sure and subscribe to this channel so that you get my regular reproductive health updates. Don't forget about the newsletter. The link is in the description below. And don't forget about my incredible podcast. Until next time, stay brave and curious.